Dr. Crawford, how do you diagnose overactive bladder? Well, it's actually pretty straightforward. First of all, overactive bladder is a problem that makes you feel like you might not get to the bathroom in time to avoid having an accident. Now, people with overactive bladder often have to pee too often, get up at night to empty their bladders. It can be a real nuisance. Anyway, making the diagnosis. Step number 1, you need a urine specimen. Your doctor's going to want a urine specimen to make sure there's no evidence of infection or blood in the urine, or out of control diabetes, something like that. Step number 2, your doctor's going to need to be convinced that you're emptying your bladder reasonably well. Now for women, not too difficult. Usually during a pelvic exam, you can tell if the bladder is reasonably emptied or not. For men, got to have your prostate checked. Make sure there's not an obstruction, making it difficult for you to empty your bladder adequately well. And finally, the bladder diary. Now, you can complete this ahead of time. If you show up to see your doctor about your bladder problem and you've already completed a 3-day bladder diary, you are way ahead of the game. They can make the diagnosis the same day as your visit and get you treated. So, go to pilates.com/women and get signed up today. If you have other questions, let me know. Leave them in the comments. Thanks.